supplies, and then we allocated in January another 13 million to reduce the grants to the behavioral health resource networks. And then we're going to meet in March to talk about what we do with the remainder of the funding. Zeb, who is on this committee, is also on the settlement board. So I'll give him a shout out there. That settlement board. And then really the only other thing coming this Friday in our newsletter, if you don't subscribe and you would like to, let us know. We're going to be doing some early wins in the comprehensive plan update. One of those I'll just mention to folks, we are launching our substance use disorder state agency financial analysis. The governor issued a memo to all of the participating state agencies a few weeks ago, and that will also include a deeper dive related to House Bill 3321 and primary prevention. So kind of behind the scenes of the committee work, we're doing a lot of work to get ready for that and start to gather information. So that was a whole lot of information, and I probably talked for longer than I intended, but please let me know if you have any questions, and always feel free to reach out.
Annalise, a question I have when you were talking about the settlement board, and I know that the first round of funding, they really looked at the continuum. Are there any updates you can share with this committee, or if there's something that we should be doing to continue that track and that the primary prevention efforts continue to be considered within that funding, or we're not quite there yet?
I think that will be part of the discussion in March. I will share, I think it's fair to say, and Zeb, I don't want to put you on the spot, but feel free. I think that we continue to hear that from the board, that the board is very committed to investing across the continuum. There was a survey going into January in which quite a few board members called out primary prevention specifically as a high priority. And I'll remind folks that we always do public comment at the settlement board. Folks can submit things in writing. When we were considering the burn allocation in January, I will call out Caroline Cruz was the only person that submitted to us in writing. And we put it on the record and read it out loud. So the board takes that very seriously. They take their job very seriously. So I don't think anybody should feel hesitant in sending public comment or expressing your opinion to the settlement board.
And I'd just like to second that. The whole continuum is very important. And we understand prevention is historically way underfunded. So please, if you let your voice be heard, and we would love to hear what you have to say.
What is the best way to share that voice? Is it, or what Jeff, I love that call to action, but can it be more specific as far as how we would do that?
Yes. So folks can always contact me. I don't want Courtney to be mad. Usually it's Lisa Shields at OHA. I think Lisa might still be out on leave. So I'll put my contact as well as Courtney Fultonier's in there. But really kind of anybody associated with the settlement board, if you get one of us, we'll make sure it goes to everybody.
Okay, thanks, Annalise and Zeb. So you have an invitation, anybody on this meeting today, if that you feel so inclined and inspired. We just got an invitation, so thank you. Wes, do you have any additional updates for us?
None from me.
Okay, then I believe, and Wes, I'll ask you to kind of clarify. I believe we had a nominee.
One quick second. We gotta
Okay.
verify it in the charter first. The position description in the charter. So and then we'll get to our nominee. So as you recall, we took the time in the last meeting to edit the charter to recognize a role of a co-chair, as well as implement and align our attendance policy with the policy at the Alcohol and Drug Policy Commission level. So in our bylaws as a whole commission, we now have an attendance clause. We are reflecting that in the charter. So I sent that out to you all. We drafted the language last meeting. I sent that out to you all. Got a couple of little tweaks, but nothing. It was just grammatical. And so I'm going to flash that up on the screen. And if we could take a vote, that would be lovely. It's also attached to your meeting invite. For members of the public, it is on the website on the meeting itself as well. So if we could take a look at that really quickly, I'll flash it up on my screen. And then we are ready for a vote. So give me just 1 second. Share screen. Zoom. Zoom.
Any ways of making your screen a little bit
Yeah, I was
the red
looking for the
sign?
Zoom. I was looking for the Zoom button. Sorry, I apologize. Okay.
That's perfect.
So the attendance clause now reads, attendance expectations. Committee members will strive to attend all regular monthly meetings unless excused by staff and or the chair. Committee members must communicate with staff on planned and unplanned absences from the regular meetings and do their best to schedule makeup time with staff to review missed content. Failure to attend and communicate over an extended period of time, 2+ meetings, will result in removal deliberations set out in Section 3.26 of the Alcohol and Drug Policy Commission bylaws. Pause there. Questions? Okay. The second clause that was amended was the officers. So it is now amended to say part one of the officers, the ADPC chair will appoint a prevention committee chair for a 2-year term with no term limits. Section 2, the prevention committee will elect a non-ADPC commissioner co-chair for a 2-year term with no limits. The co-chair is responsible for supporting agenda development and facilitating the committee business in the absence of the chair. And then finally, a clause that was already here, but we moved it down. A member of ADPC staff shall serve as secretary of the committee and is responsible for supporting the business of the committee in coordination with committee chair and co-chair. And then we make one reference to the committee co-chair here in conducting the meetings and assisting with the development of the agenda. Pause. Put back on the screen so people can see. Any questions? All right, Debbie, I think we're ready for a motion.
Like to have committee members, if someone would make a motion to approve the update to the primary prevention subcommittee's bylaws. We'll entertain that at this time.
I move to approve the updated bylaws.
Thank
I
you,
second-
Pam.
I'll
Is that
second.
Caroline?
Yeah, I'll second it.
Thank you. The motion has been made and seconded. Any additional comments at this time? Okay, Wes, no comments. Would you please do the roll call for the vote?
All right, for approval, please say aye. Caroline Cruz,
Oops. Aye.
Debbie Jones,
Aye.
Pam Pierce,
Aye.
Frankie is absent. Lindy Petty,
Aye.
Shauna,
Aye.
Alexis,
Aye.
Amy Zimmerman, are you back? Did you make it? Okay, absent. Zeb,
Aye.
Amy Muhlenberg,
Aye.
Luis,
Aye.
Beth,
Aye.
Darren,
Aye.
Miss Jessica with us. Okay, Jessica's absent. Okay, the ayes have it unanimously.
Great. Thank you, everyone, for helping us with those procedural matters. And Wes, can we move forward with the nomination of the co-chair?
Yes, so we asked for nominations for a co-chair to fill that role. Luis Pimentel was nominated, and I don't know, Luis, if you want to say hello. No, Luis accepted. You want to introduce yourself for the public?
Yeah, hi everyone. I've worked with a few of you on here in a capacity or another in different meetings, but I work with Lane County Public Health. I'm the ADPEP coordinator there, and happy to be nominated and accept a nomination. And we'll leave it up to you. But if you all ever have any questions about any of the work being done in Lane County or how we can best partner, because I do quite a bit of meetings and brainstorming sessions and things across the state with other partners as well too. So always happy to connect and learn from other folks as well.
Thank you, Louise. So I'd like to entertain a motion to approve Louise Pimentel. Did I say that right?
Yes, Pimentel.
Okay. As our vice chair.
I'll make a motion to approve Luis as our vice chair.
I'll
Thank you,
second it.
Caroline.
I'll second
Thank
it.
you, Pam. Pam seconded. We have a motion and seconded. Any comments? Questions? Shauna?
Make a comment and express gratitude for Luis for stepping up and offering to serve in this way for the committee.
Thank you. Thank you, Shauna. All righty, Wes, I think we're ready for the vote.
Yes. When I call your name, please state aye if you accept the nomination of Luis. Caroline,
Aye.
Debbie,
Aye.
Pam,
Aye.
Lindy,
Aye.
Shauna,
Aye.
Alexis,
Aye.
Zeb,
Aye.
Amy Muhlenberg,
Aye.
Luis,
Aye.
Beth,
Aye.
Darren,
Aye.
Martin. I saw you come in.
Aye.
Thanks, Martin.
Mhm.
Welcome.
Thanks.
All right. We have a new co-chair. Congratulations, Luis. Thank you so much for agreeing to serve.
Yes. Thank you very much, Luis. Happy to have you on board in a different official capacity, and appreciate those that nominated Luis. And we're at least done. And Luis we're in good hands. Me, you still got to worry about. All righty. I am now very excited to turn the bulk of the meeting over to have that report back from Tim Rourke with Third Horizon. Tim, you ready to turn our wonderful days upside down and just energize us?
Ready as always, Debbie.
Tim,
So yeah, Wes, go ahead.
would you like me to share or would you like to share?
I've got it, I think.
Okay.
If someone could turn sharing on, I've
Yep.
got it up and ready to go on my end.
I've made you a co-host. You should be good to go.
Excellent. Thank you. So hello, everyone. I was not able to make last month's meeting. I know some of my team members did. But for folks who are new to the group or members of the public, my name is Tim Rourke, Managing Director at Third Horizon. I'm joined today by a couple of colleagues who, again, for the good of the order and appreciating there's some new folks here, I would love to just give them a moment to quickly introduce themselves to you because they are part of this project as well. So Elvina, let me turn it over to you quickly.
Thanks, Tim. Good morning, everybody. Elvina Faridi. I'm a manager at Third Horizon, and I've been part of the prevention work with the prevention committee as we were doing the comprehensive planning since all of last year. Many familiar faces today, so good to see you all. And I'll pass it over to, I think Lindsay's on the call as well.
Thanks so much, Elvina. Hi, everyone. My name is Lindsay Reeves. I'm a director at Third Horizon. I have been involved with the ADPC comprehensive planning process over the last year, and then had the opportunity to delve into the prevention landscape and world related to this report and the subsequent planning for the Center of Excellence. So I'm very thankful to have the opportunity to be with you all today, and I look forward to the discussion.
Great. Thank you both. And our colleagues, Caleb and Alex, I don't think they're on the call today, are part of the team that's supporting the ADPC and the Prevention Committee going forward this year around the analysis of House Bill 3321. So you'll continue to see us in today's presentation. It doesn't talk about that directly, but certainly this conversation is going to inform and relate very deeply to some of that financial and programmatic analysis we're going to be doing over the course of the year with all of you. So what I'd love to do is we have about 45 minutes. I'd love to level set a little bit of grounding. I know folks on the call had a good discussion around the report, gave some feedback at the last meeting. There was some further feedback that was shared with Wes that was sent directly to us. And I want to thank everybody who took the time to review the report. Our goal today is to level set the entire group around what the report is and is not, identify a couple of thoughts in reflection of the feedback that we received from all of you, and then to have a bit of a facilitated conversation, because what I think is important is this is an opportunity, the development of this Center of Excellence, and I will borrow Debbie's air quotes, appreciating that what this gets called is a topic of conversation. This is an incredibly high priority of this committee, as you all know from the work on the comprehensive plan. And so today, we hope we can start with you all and invite you all to begin a conversation around some of the decisions that this committee needs to make, which may be informed by these recommendations that are developed in this report or through some other inputs that you all have. So what I'd love to do to start is just to remind people how we got here, because we're really blessed to be able to work with you all in the ADPC in a number of different ways now. And so which hat we're wearing today and how this report came to be, I think is just important to ground us in, because it's a little different than some of the other reports and work that we did with all of you during the planning process for those of you that were here. So during the process of developing the comprehensive plan, the Washington State ROTAC, the Rural Opioid Technical Assistance Center, which was part of Northwest PTTC, reached out to the ADPC and said, we have some resources available, a small amount of resources that are going to expire. And we'd love to put some of those, a little bit of resources into something that supports the comprehensive plan. When the PTTC brought this opportunity forward, there was a brief discussion, and one of the recommendations was to utilize some of those resources to engage Third Horizon to conduct a bit of a national landscape analysis, recognizing the importance that the Prevention Committee had already placed on the development of some sort of centralized technical assistance hub, to do a little bit of a landscape analysis around how other states organize these kind of structures to the extent that they have them, how they may relate or interrelate with other technology transfer centers, other national groups, et cetera, and to sort of take a look at whether or not there might be an already existing analogous group or structure within Oregon, or is there a different way to think about this that may require some new investments and new model building? So that was the task that we were set out to do. So this report is a culmination of the findings of that inquiry. This is not as you probably noticed, and I think some of you picked up in the feedback, this was not an ADPC report. It was a report that was done for the Rural Technical Assistance Center with a focus on Oregon, but recognizing that these dollars, the intention of the dollars that went into this report required that while the report may directly benefit a process underway in the state of Oregon, it needed to be able to elevate some lessons learned and recommendations that are possibly translatable in all of the Northwestern states where the Northwest PTTC was doing work. So I named that because I wanted to explain why, in some respects, it spoke directly to the ADPC, and then in other places, it sort of referenced generalities that could have existed in other states and were not place specific. That had a lot to do with the nature of the funding source and what was required in order for Washington State to be able to make this investment. So I just wanted to put that out there for folks to understand that as we ground in today's conversation. The last piece of this is that the goal of the deliverable was to offer up some recommendations. These are recommendations for you as a committee to react to reconcile, to adopt, or not. This is, we do provide, and you will see some of the recommendations that we have from the vantage point of having conducted this analysis in our own work with similar technical assistance centers across the country. But to be clear, while some of what came out of these recommendations is validating to the work and the visioning that many of you have discussed within the comprehensive plan, this is a discussion starter. It is not intended to be a blueprint that you have any direction to follow. So you are welcome to adopt some of these recommendations or not. Our hope was that these findings would just spur conversation, and clearly from some of your feedback, it does. So what I'm going to do is I will walk through a little bit of just the basics of what the report suggested. Some of it, again, if you've read the report, a lot of this is just summarizing what you read. But again, in the spirit of level setting. And then I want to talk through some of the feedback we got, our perspective on how you should think about some of the questions or observations that you've raised. And then we have some discussion questions that we'll work through together in this conversation. The one other caveat that I'll state before I begin is also to note, because this report is a product of the Regional Technical Assistance Center, we're not making additional edits to this report itself, save one thing. And thanking the group for recognizing that we were very intentional in our work around the comprehensive plan. And this group has been very, very intentional of elevating, when we utilize the term evidence-based practice, to also elevate tribal-based practice, recognizing that there is a really robust ecosystem of tribal-based practices in Oregon that many view as integral into the prevention system as well as in Oregon as a whole. So that is a thread that we didn't entirely follow through in this report. But because we feel that's really important and important to the state of Oregon, we are making adjustments to the report, and we will send a final version to all of you that will be inclusive of more of that tribal-based language, because that is a priority that was named here and is something that's going to be a thread as we go forward. So I just wanted to name that, and we'll have a final version of the report to you shortly that will include just that language change. So as a reminder, and again, mostly for folks at the public level, in the development of the comprehensive plan, the prevention committee has talked almost from the very beginning about this idea of a hub or a one-stop shop to deliver and support a prevention ecosystem in the state of Oregon, with some ideas that it would do a few different things. And this came up again and again in conversations that this group ruminated on throughout the planning process and even prior, right? Having something that is centralized and organized that can really focus on supporting the delivery of evidence and tribal-based practices throughout the state of Oregon. A ecosystem that can do more to both strengthen, sustain, and grow the primary prevention workforce. A system that can ensure that there is an accelerated ability to deliver prevention services at equity, which means that services and programs and practices are available across the state, recognizing that there are differing capacities from region to region, and really trying to make sure that the playing field is leveled and services are available to all. And a recognition of a desire to really become more data-driven and to create an easier, more elegant infrastructure to capture data and outcomes and tell the story of prevention in the state of Oregon. So that was the grounding work, and it was this committee's real vision for that led us to develop this analysis work. We did a few different things that I want to call out in terms of how we did this report. The first is we did take a look at a landscape analysis of technical assistance centers that exist at the state level. Some of the technical assistance centers that we highlighted in the report, myself or our team have direct interaction with. So we're familiar with how they operate at a state level. Some of them we just did some research on in order to understand their work a little bit more. But we really did look at other states that have different models of how they approach prevention technical assistance in their particular state. And we looked specifically, obviously, at those that did it around primary substance use prevention. There are TA centers at a state level that don't, that might deal more in treatment or more in recovery supports. So we did try to focus on those for whom either all of their work or a sizable portion of their work was prevention specific. We then conducted some key informant interviews, and I want to thank Debbie and Pam and Wes and other members of this committee contributed to us names of stakeholders and partners that we should talk to. The way that when we approach an analysis like this, we get usually a broader list of folks than we end up talking to. So we had 13 different stakeholders who were identified by partners, many of whom in this room right now. We invited all of them to participate. We got about 7 who came back to us, and we were able to do interviews with 7 organizations. We will share who those were in a moment, because I know that was a question that people asked that we did not specify in the report. And then we worked based on that feedback, what we learned from other states, and talking to those groups. We, again, wanted to try and identify some of the considerations that you may want to think about in terms of operating structure, sustainability strategies, and again, what you all need to think about as you begin the process of putting a service like this on the ground in the state of Oregon. So, what were the state's models that we looked at? We looked at a few. And again, these are mostly in the report, so I won't spend a ton of time on them. But we looked at state-based technical assistance centers in California, in Colorado, where there's actually, and Colorado both and California, and some states might have more than one who's doing TA. It may not necessarily be a one-stop shop. It's dependent on the state. But we looked at California, we looked at Colorado, we looked at New York, which has a regionalized approach to technical assistance throughout the state. We looked at New Hampshire, which has 2 different TA centers for primary prevention right now that has sort of a split scope of work. And then we also looked at North Carolina, which has several TA centers, including one specifically around prevention and then one specifically around collegiate work, that are baked into their state's providers association. Looked at their staffing structure, looked at their funding models, and some of what they were designed to do and not do as we think about your collective work. Couple things that we elevated in terms of these that were common across states that we talked to. Most states have technical assistance centers where they have credentialed prevention staff. So people with a CPS or their state's equivalent who have demonstrated experience in substance use disorder prevention, who are driving the work. They may have been practitioners themselves. They may come with a more academic or evaluative mindset, but they all had primary substance use prevention experience in their backgrounds. Most states are not funding their technical assistance centers through a single source. Many are braiding. They might be using a mix of state funding, federal funding. In New Hampshire, there's a significant philanthropic investment in technical assistance, and we're seeing a number of philanthropies generally thinking about technical assistance as a workforce strategy, and beginning to make investments in this space. Most of them had some sort of support structure, which meant they could be responsive to technical assistance inquiries that came from a provider. A school district says, I'm looking for TA to implement this evidence-based practice, as one example. It could be direct TA that's delivered to a nonprofit, a school, or a program. Others were doing more sort of learning collaborative models. Where a state might be looking to have a prevention program adopted statewide, And so they might develop a learning collaborative where a number of different partners are working to implement the same evidence-based or tribal-based practice at the same time. And the center is convening those in a learning collaborative style to have the program expanded, validated, and replicated in multiple partners across the state. Almost all of them partner with their national TA networks. And this becomes important, obviously, as you have the Northwest PTTC. As you'll see in a minute, and as you may know, most of the key informants we talked to, many of them were those national groups who both work in states that don't have a state level structure, but then also benefit from partnering with states who do. The other thing I will note is that while I said we limited our review to TA centers that are doing primary prevention TA work, because not all substance use TA centers do that. The ones that we talked to, many of them, they are doing technical assistance across the continuum. Whether in sort of differently branded TA under one umbrella, or in the case of New Hampshire, their technical assistance center started providing exclusively technical assistance in prevention, but now they provide TA in recovery and treatment as well, sort of leveraging that infrastructure across the continuum of care. Not every state does that. Your priority obviously is to build something that's prevention specific, but I would just name that a common thread from a sustainability standpoint was that many TA centers did expand their service array and their TA offerings to include other parts of the continuum of care over time. So then we did a series of interviews, and here's just quickly who we talked to. Obviously, we talked Northwest Prevention Technology Transfer Center. In addition to their ROTAC program funding this work, we spoke with them as well, given the TA they provide in the region, as well as in Washington specifically. We talked to the Center for the Application of Substance Abuse Technologies, which is national. We talked to NORC, which I know many of you, they're engaged, I know, in some work with Debbie and others around SBIRT here in the state of Oregon. But they do TA in a number of other states as well. We talked to OSU Center for Health Innovation, the Oregon Coalition of Prevention Professionals, the Partnership to End Addiction, and we also talked to folks who lead tribal prevention work in the state of Oregon. So we had a little bit of a mix, like I said, of national folks who directly provide services in Oregon, but also folks who might work in other states who could also give us a bit of a lens as to how they view Oregon's infrastructure and opportunity compared to what they see or experience working with other states. Couple of common themes that came up in these interviews, right? A real focus on equitable access and rural capacity. And a hunger, obviously, with rural health transformation and other things. There's a lot of attention trying to be paid around how to deliver technical assistance in a rural environment, recognizing that that can be particularly challenging, especially for statewide organizations or national groups who might only come in and be very place-based one-off in the TA they provide. So I think there was a lot of hunger to see something that could really address understandable gaps in delivering technical assistance, particularly in rural areas, that people wanted you all to consider. There was a recognition around the importance and the validation of, I think, your committee's priority around this as part of the workforce solution, recognizing it doesn't solve for everything, but the need and the opportunity to see what kind of leverage technical assistance could also advance the workforce, sustain the existing workforce, retain it, as well as create recruitment and referral pathways to bring new people into the workforce as well. Most of the centers and most of the TA providers that we talk to nationally, again, similar to you all, they do a lot of work with schools while recognizing that schools can be particularly challenging, is something we talked about in the development of the comprehensive plan in terms of just how tough it is for school districts, whether it's because of bandwidth issues or unfunded mandates or lack of resources. But a lot of TA centers are really focusing their attention to see what they could do to support schools specifically, recognizing that schools can have a particularly challenging time getting the kinds of support they need to engage in successful prevention efforts. Most of them are looking at systems coordination and integration. Most centers at the state levels as well are charged in some instances with making sure that they've got those collaborations built. I think many of the national partners look for that and are attracted to the idea of having kind of a one-stop shop they could go to and foster a relationship with that could then disseminate their technical assistance and their national capacity out to the right partners in a community, because sometimes I think national TA centers really struggle wanting to make an impact at a statewide or at a systems level when there isn't a centralized TA center that they could potentially partner and work with. And then a recognition that a lot of the centers are tasked with and asked to do data and evaluation work and work to determine evidence-based practice. And again, not necessarily, some of that can be helping support the implementation of existing practices that are already sort of identified as evidence-based or tribal-based, but increasingly as well, opportunities to support emerging homegrown programs that show promise, and centers and technical assistance centers perhaps being well positioned to provide low cost evaluation and technical support for programs or interventions that show promise that actually could benefit from having further evaluation done, but where in many instances, getting that kind of evaluation work can be cost prohibitive. So a couple of things that came out from our recommendations for you all to think about in the report, as we talked about. We sort of invite you to think about this around kind of 4 different pillars. And as we proceed, or as you all proceed as a committee to discuss and make decisions that will ultimately lead to potentially a procurement process and the funding and the development of a center like this in the state, want you to think about it in these 4 ways. First is the scope of work. What is it actually that the group is going to be doing? There's a lot of opportunity, but what you don't want to create when starting something new is a lot of white noise. So one of the key decision points that you're going to have to collectively make is that of all of the things that a TA center can do to support primary prevention, what should they do at the outset? And that is different. Most of the state-based TA centers, it's different for every community. It's different for every state. That's a decision you're going to have to make. The other pillar is governance and structure. And we have some recommendations around structure for you to consider that we'll discuss in a second. Deciding on the staffing capacity. Obviously, again, many of the centers we talked to, having a credential in prevention and deep experience in primary prevention was vital. But are they practitioners? Are they evaluators? Are they data analysts? Some of the capacities that you would need in that staffing needs to be determined, I think, by all of you, again, relating to that scope of work. And then pillar 4, obviously, is sustainability. We did not find a center that's funded by one source. And I would say, particularly for centers that have existed for some time, much like the rest of the prevention field and the rest of behavioral health services in general these days, funding is coming and going and is very volatile. And so just to note that I think as you all think about building this out, you'll want to keep sustainability in mind because most centers have had to bring in resources from multiple places in order to make the economics of a center work, especially those which we named in the report where the delivery of the technical assistance, the goal is no cost, right? That's a decision point. Obviously, some TA centers, you have to pay to get that service. Many states have tried to build out these state-based infrastructures in part because they want to make technical assistance available free of charge to the end user who needs it. So thinking about those kinds of things is going to be important. I'll just name this really quickly for time. I want to get to some of your feedback so that we can open up the floor to discussion. But we recommend a couple of things that you should think about as you begin to contemplate exactly what this needs to look like for the state of Oregon. Recognize first off that there's a number of different things that you all have expressed or the committee has expressed over time you want the center to be able to accomplish. There was talk about a centralized resource, a talk about training, and particularly training that can meet people at various stages of their professional development or growth in the field. The ability to respond quickly when there's an emergent need that requires real-time technical assistance to support the field. The ability to have a center that can pull data, pull stories, pull expertise together to translate out important prevention information that can inform or should inform good policy work, whether that's at the legislative level or even at the regulatory or practice level. And then I think a call out to recognize collaborating and partnering with academic institutions. Oregon, unlike some states, has an ecosystem of academic focus in substance use prevention, which can be used to your advantage. In a couple of states that I do work with centers in, they don't have that. So I think thinking through strategically how to foster and leverage that will be important in your discussion. We do recommend that you consider a hub and spoke model. And by that, we mean having the opportunity to have a centralized center of excellence. There's my air quotes again for Debbie. But at the same time, think about developing it in a way that has some regional representation. As a logistical matter, technical assistance can sometimes be delivered via Zoom and in hybrid, but a lot of TA also might require in-person engagement. And in order to ensure equitable coverage across the state, you probably want to contemplate envisioning what it would take to build out a center of excellence model that would have staff available within some regional structure so that local partners have easier access and engagement when they need TA delivered in their communities. There is we recommend, and in most centers that we've seen, they have some advisory oversight. Our recommendation is that's you, and this came up actually in the conversation across the comprehensive plan. You have a prevention committee. This is your priority. That having in a go forward way once the center is established. Many of the centers that we work with that are particularly effective are in lockstep with whatever the state plan is or the state strategy is, and are working with those entities to make sure that the technical assistance they're providing doesn't just meet the needs of an individual provider, but moves the system forward. So we would recommend and just reinforce and validate for you all that once the center gets built, you should continue to expect, or you, the prevention committee, would be well positioned to serve as an advisory in support of the growth and development and the tactical work of what the center does going forward. Again, we also recognize and recommend that there's real equity in that infrastructure. I want to just highlight and elevate and celebrate the unique nature of the tribal-based history and capacity you have in Oregon. And throughout the comprehensive plan and in our inquiries in this particular analysis, many of some of the tribal leaders we spoke to felt very strongly that there is real opportunity to leverage tribal-based practices more broadly within the state of Oregon. And so some intentionality to ensure that that happens and that this serves as an opportunity for that is something that many that we talked to called out as an opportunity for Oregon. So, and you'll have this slide deck for you to continue to think about. But again, just from a structural standpoint, you can kind of see here another way of thinking about this hub and spoke model, again, with some regional representation to advance and support the work at the local level. We really do want to encourage you to follow what we found in most other centers, which is that the funding is ultimately braided. Obviously, and I'm sure Wes will be able to share a little bit about how the ADPC will think about this from the standpoint of thinking about financing this. But ultimately speaking, it's going to have to be something that is looking at leveraging resources from several places. We've had some engagements with centers where the state, quote unquote, is the lead funder and might leverage resources that flow through the state from a number of places to create a consolidated or braided contract. But we've also seen expectation and performance metrics passed down to centers on their own to go after additional resources, whether that's receiving direct federal funding to deliver technical assistance or other funding opportunities. So we've seen that kind of work in a few different ways, but would name that up front, some thinking not just about how do you finance this in the short term, but can the prevention committee consider and support and engage across invested stakeholders at the state level and other places to identify other sources of funds that could help grow and sustain this work going forward after it's been built. The other piece that we wanted to name, and it came up in the feedback that folks gave, just as a reminder, and this validates, I think, what many in the prevention committee had said as we were developing the comprehensive plan. There were two things that the committee said throughout the process that are central to the comprehensive plan prevention strategy. The first is the center. And the second is House Bill 3321, right? So we get a clear landscape analysis of what the funding is available, what the services are, that currently constitute the prevention system as we know or discover it. And then how do you build a technical assistance infrastructure to support that ecosystem sustainability and support the growth to address gaps in services in a way that is streamlined and systematized? So we really want to validate and strongly encourage that you all continue to think of this center as the center, as the central hub, the node of your prevention strategy. Most centers that have been super, super effective, again, their scope of work aligns almost exactly to a state plan or a broader strategy that is determined by the field. Centers always, for the most part, have some responsive ability to meet people on the ground and deliver technical assistance based on needs and priorities locally. But even in those instances, they're grounded by something that's happening at a systems level to move the whole system forward. You have clearance and authority and sort of permission because of the ADPC and the prevention committee to really hold that. And we would encourage you to do that in strategizing around what the scope of work is going to look like when you launch. So a couple pieces of feedback, and then we'll open up our discussion. And this, again, I want to thank everybody who shared their questions and their feedback with us. What we did is we sort of synthesized all the feedback that came in into a few different buckets, and then suggest a couple of responses based on our understanding. But certainly this is the place where your conversation will have to continue. So a couple of things. What's the center responsible for? You're going to see this mentioned several times. What the exact scope of this center is for you to determine. And so your discussion as a committee over the next year should answer that question. There are a lot of things a center can do, and over time, it may be able to accomplish a lot. Your task will be to refine and define a reasonable scope of what you think they need to start doing in service to your comprehensive plan and vision. But that's the scope piece that you all get to determine in this year going forward. What is the center? Is it a visioning entity? Is it a coordinating background? Is it an implementation driver? And again, I think this was said in the planning process, but it bears repeating just to reinforce and empower you all. The ADPC sets the vision. You set the vision. The center is a tool to execute and deliver on that vision. So for you all, again, we encourage you strongly to come back to those key priorities in the comprehensive plan, and then think about the scope of the center in the context of what the center can do to serve those priorities that you've already determined. Again, from the oversight perspective, as noted earlier, it's you. And I think, and Wes has reflected this, I think, and Annalise, I think the ADPC is very clear that this is a body of work. This is an entity. The contracting of this would come out of ADPC, if I remember it correctly. You all would have direct oversight of that. And that gives the prevention committee an opportunity to really drive and to make you feel empowered to be able to do that. There were questions that came up around, again, we want to stick with and be protective of primary prevention and the focus on that as defined by primary prevention. And so, again, I think ultimately the policing of that, for lack of a better word, or to say, like, how do you regulate that and make sure that a technical assistance center doesn't get into mission creep, has everything to do with scope. Ultimately speaking, this is something that you should define a very narrow scope that keeps in the definition of primary prevention. And like any agency or any organization that receives a contract, that's the scope of work that they will be able to undertake. Now, you might find that there are TA partners right now who exist who could, who might do TA and treatment, and they want to offer up, well, we could do this too. That may be true, but I think ultimately that decision around keeping the work really clean is everything to do, again, with your scope development, what you want this organization or this infrastructure to do and what you don't want them to do. And you all are going to have to take some responsibility to coordinate and define that really tightly. Relative to 3321, and this was one of the most, around making it connections to other parts of the continuum of care. Our recommendation, which I think many of you feel as well, but just to hit it home, we do encourage you to focus on primary prevention. And to the extent you want a center to touch on other ripples in the pond, whether that's, yeah, let's have this TA infrastructure because it's been successful, support treatment or recovery supports, or, where this is a substance use prevention thing. And we want this TA center to become more connected to early childhood, which I know is something that you've all spoken about. That's not a bad idea, but you want to stage that. You probably want to hold off on some of those continuum of care things farther down the line, except for the fact that to the extent you want them to begin to make connections, show up at meetings, build collaboration in pursuit of that long term, that obviously could be part of the scope of work. But we would suggest that you don't do that right out of the gate. Couple of governance things. A lot of this, I won't go through each one. Again, as you scope out the what this should look like, it's for you to determine and should be scoped in the RFP. So do you want this as a standalone entity? Would you be open to an organization that already exists or is embedded in a larger organization to come in and offer to deliver this service? That is up to you to decide. I would suggest we did not, in our analysis, come back with a clear sense that there's one entity that's already doing this. We also did not come out of our analysis with a sense that there is a specific type of organization, either in general or specifically in Oregon, that you should talk to very directly. There are a number of ways in which these kind of TA centers are built, and I think it's up to you to determine how you want that structured. And then let that flow into a procurement process that would afford the right kind of organization based on your collective needs and interests to come in and bid on being able to do that kind of work. So whether it's standalone, whether it's under a fiscal agent, that is, I think, work you should discuss in advance of an RFP. Governance authority, we've already talked about how the center should work with other entities that own prevention dollars. I'd harken back to our leverage and braided funding recommendation. I think the committee should consider continuing to think through how do we, and this is where I think the analysis in 3321 will be helpful. Where are there other resources, other funders across state government that might have a need within their contractors to have this kind of technical assistance? And is there a way that we could think about a braided funding strategy and engaging some of those partners in a leverage conversation going forward? Obviously, again, we wear a couple of hats. We are also doing this 3321 analysis with you. And many of you said, well, how does this fit? What should we talk about now versus what should we wait until the House Bill 3321 analysis is done to consider? We think that we will find some important information in terms of financing and what prevention looks like on the ground that would certainly inform both the issue of sustainability and the issue of scope. And we recommend that we let that process play itself out. And as you try and think about what are the first bundles of work that we would prioritize with the center, how would we initially propose to have it funded, or what partners would we need? Some of 3321's analysis is going to illustrate some of that for you. But this question of what the governance structure is, how you staff it, those are the kind of conversations you could begin now. Because again, I think whether you want a hub and spoke model like we've suggested, or you think structurally delivering TA needs to look a different way in the state of Oregon, those conversations I think can begin even while you wait for some further information about from 3321. And again, as you think about scope creep and coordination, I mean, any coordination you want to see a center do, you just write it into the scope. So I think you have a lot of latitude to set expectations. You just want to set those expectations in a way that is realistic to both the staffing, the governance structure, and the funding available in terms of where you want to begin. I think someone did say again, how does it become part of the implementation structure rather than a parallel effort? I recommend real bullishness about alignment with the comprehensive plan. Again, there's a lot of ways in which a center and a TA infrastructure can be helpful. But for now and at the moment, this is about having an infrastructure that accelerates the ability to implement the plan successfully. And that should really be your guiding light as you define its scope and really give it its marching orders as you conceive of this work going forward. Again, there's a number of other integration and avoiding duplication efforts. You can contract your way into addressing a lot. And so for folks who have not been a part of a visioning process that ultimately will lead to a procurement, which this might, you again will have a lot of opportunity to hone in on some of these questions going forward. Do want to address workforce. Because we got some questions that came in around how does this complement the workforce? How does it complement the Oregon Coalition of Prevention Professionals? Again, I think it is an critical and important leverage opportunity. So partnerships with those workforce pipeline infrastructures and tables is super, super important. Obviously, we've worked with a couple of centers where there is a strategic decision to make sure that what the center is delivering, it might be also direct to TA, but perhaps there is underneath it some training and technical assistance that counts towards certification and licensure, that helps bolster people's credentials and making sure that the infrastructures and support systems are in place to make that happen. So I think building out those partnerships and defining that in your scope will be important. Someone did ask about job demand. Can we make this attractive enough? Can this be part of a solution to increase the number of people who choose to go into the prevention profession or earn their CPS? Yes, maybe. But our encouragement is to think more about at the beginning around retention, professional development, and retention of those who are already in the system. Noting that recruitment, bringing in new people, having people show up and receive TA and then decide to go deeper in their own prevention professionalism, that could be a great secondary benefit. But most centers tend to live a little bit more in the retention space when it comes to workforce issues. Lastly, a couple of things just around measuring success. Again, much like everything else, how you measure this is up to you. And so we do suggest that you think about a measurement strategy for the performance of the center that is staged, much like we did the comprehensive plan. So if you're building it in year one, there should be staff. There should be the ability to deliver some form of technical assistance that is highly aligned with at least one comprehensive plan priority. And that we're able to deliver against the scope of work that you envision for it. Long term, do we see a growth in professional knowledge? Do we see more people acquiring their CPS because they're engaged in this work? Do we see an expanded number of prevention programs in implementation? All part of the state plan. Remember, if you read the comprehensive plan, short term, midterm, long term, you want to think in the exact same way as you develop the performance metrics of the center. People asked about supporting local measurement. We do encourage, I would suggest that you think about providing that infrastructure within your center. In some states, their center of excellence is the one that they may help administer statewide youth risk surveys. They may provide technical assistance to providers to take that data and translate it into community conversations and facilitated dialogues. So something around, again, in a responsive way, you probably want to think about, do we have some data analysis capacity to support evaluation at the local level? And then again, the issue of reporting burden, I would caution some states, and I know it's come up here, some states have looked to their center to deliver technical assistance on behalf of the state agency. So for instance, the state agency might have a challenge around data collection, so they contract out a center to do it. That's an option. That is a thing that some states have done. Sometimes that gets cloudy. So I think for you all to think about who the customer is and what data infrastructure is needed, whether or not you want your center to be a reporting vehicle between providers on the ground and the state directly is an open discussion that we think you should have. Some centers have run into trouble trying to fit, or states have run into trouble where that has not worked out and is actually, to the point of the question, created more burden. However, increasingly, I will say in our work across the country, we're working with a lot of providers who talk about administrative burden. And part of the problem is, yes, the regulatory environment that creates it, but part of the problem is also operating infrastructures that aren't elegant, not leveraging technology in a way that makes administrative stuff more burdensome than it can be. And some technical assistance around operations and reporting might actually help alleviate reporting and administrative burden by helping organizations get better at their own administrative infrastructure. So that's a TA concept you might want to consider within your center. So all that being said, and I know this is a lot, this is a beginning conversation for you all. There is much more for you to discuss, and this will be a conversation I know that this committee is going to want to have in an ongoing way between now and when it is time to release an opportunity to launch this group. There are a couple of things that we think you should contemplate, and we'd love to spend some time today both getting general reaction and sort of thinking through in the time we have left just a couple of these key questions. We really encourage you to think first and foremost about the governance model. We've recommended a hub and spoke system. We think that might help you achieve equity in terms of making the TA available across the state. That may not be realistic to start. There may be other reasons why you think that's not the right model, but we would suggest you spend some time on that. We suggest that you also spend some time thinking about the long list of things you want to see done differently in prevention, the long list of programs you want to see expanded, deepened, proven, et cetera, and the long priorities that are in the comprehensive plan, and start to define where you want the center to begin, because your initial launch scope should probably include a very limited number of specific TA opportunities that should be highly leveraged to move the plan forward. It probably won't be the universe of everything, but where you begin is something you all need to discuss. And then the other piece, which we can certainly talk about today, but I would just be an open invitation with you all to be back in touch with Debbie, Wes, Pam, and our team, is that like we do believe that our inquiry into House with 3321 is going to give you fiscal and programmatic information that will inform your scope and inform the scale of what a center could look like. But as you engage in the conversation around the development of the center, if there are questions around the needs of the prevention field or gaps within the prevention field that we should include in the House Bill 3321 analysis, we'll be open to that feedback, because we do anticipate coming up on a period of time where we're going to be going out and doing surveys with providers and surveys with the field. And so there may be a place where if there's other information you'd like to get from community leaders as you think about the center, there's a way we might be able to integrate some of that into our House Bill 3321 work. So I would love to pause. I know we only have a few minutes left. That was a little longer than we thought, but it's a lot of information to digest. And again, would love to just think about a couple of key places where you'd like to begin having the committee and conversation. And Caroline, thank you for raising your hand. We'll start with you.
Okay, so a lot of people don't know our history. So we did have an Organ Prevention Resource Center clearinghouse. We opened up in 1987 because that's how I was first hired to actually direct the program. So we actually developed it on the state hospital grounds. The address was 2600 Center Street. I always remember that because it was easy to remember. So we were in the basement and we operated like a library. Now, this is prior websites, so we didn't have the computer access that we have now. So what we did was we reached out to different folks who was developing prevention material, may they be pamphlets or may they be actual curriculums. We actually had people give us their curriculum to lend out, but we would clear it first. We would make sure that it met whatever standards that we had in defining prevention at that period of time. But we would loan out these curricula so they could see the product before they actually invested in it and bought it. We also published pamphlets. And so we were a radar, and I don't know if radar still exists, Tim. I mean, remember radar? I mean, I don't know, but we were a radar center.
Yeah.
And so they would send us publications, and then we would distribute them, or we would get masters and we would actually publish them. We also provided TA. We went on site. We did trainings. We had a satellite office in Portland and another satellite office in LeGrand here in Oregon. And then we were also responsible for the prevention conference, the annual prevention conference. And then we had Teen Institute. And then we had a high school with what was called Awesome, Oregon Student Safety on the Move. We got funding from the Department of Motor Vehicles so we could reduce underage drinking. I know we connected with the university so we could do prevention on campuses. And we did this with 3 staff at that time. There was just a director, assistant, and a support staff, or we called them secretaries. I guess we can't call folks secretaries anymore because that's not what their title is. We had to close down because when the economy was suffering with state funds, when they looked in terms of what was needed, of course, treatment money was needed more importantly than having a resource center. So what we had to do was we created a training center where they did all the trainings, and then we transfer all our resources to them for them to distribute. But so some of the stuff that you were saying, I forgot what it was called, the Western Center of Technology before it became PTTC. We operated out of the Reno district, and I know there was an Eastern one. There was, I think, one in New Mexico or Oklahoma somewhere, and we collaborate with them for the latest information. And this was before certification was put into our organ administration rule. I think we officially did that in the 1998, where we put in the organ administration rule, which then the training center, we start sponsoring prevention certification, training, so we could stay within the guidelines of the, I forgot what it's called, because I remember working on these tools in clearing something in Florida. Oh God, it's something with a C. It was a certified regional something for the testing that they do the certification prevention specialist certification process. And so we matched that all, but we did have one. And so a lot of the things that you were saying, we had, but
Yep.
you're correct. We didn't have the funds, or we were not a priority when the going went tough. And we don't have the same titles of the folks that we have now, but we have similar. Now we have in the tribes, we have the Northwood Portland Health Board. We have any health service dollars, and we could braid those fundings, but I'm not as familiar with what we have at the state level. I don't even know what the organization chart looks like anymore. So, but we
Yeah.
did have, so we
Yeah.
can't.
And some of that, and I think, and some of that too, particularly on the financing side, to your point, Caroline, I think some of that we can unpack for you. In some states, the way they've been able to fund their centers is that, sometimes it's one-off, so it's not everything, but most federal contracts that come down might have a percentage for technical assistance or a percentage for evaluation. And so what some states have done, if they've built these central technical assistance centers, is they use that carve out. And then that work gets funneled to that center, right? So that as states take in dollars that require some evaluation work, they're using that directly, because very often those opportunities that states go after are aligned with some of that strategic work. So I think some of that is work that we'll try to unpack a little bit when we do the financial review, because again, that's where I do think, the question on the table sort of fiscally is, can we unlock, is there capital that could be unlocked that may already be at Oregon's disposal that could make smart investments in something like this? In addition, I mean, certainly new money would be great. But the other question is there some other places where actually there are resources that might be well positioned if they were leveraged in this way? Martin, I saw your hand, so I'd love to call on you. And then I know we're at time, and our group's going to be working with you all over the next year, but I want to sort of wrap before we get to public comment, just giving Wes a moment to sort of talk about some of the next steps here. But Martin, go ahead.
Yeah, no, thank you, Tim, for that pretty comprehensive overview. Um, And you did just sort of answer, I guess, in part my question. So I'm assuming that the states that you all have worked with, primarily they use the hub and spoke model. I'm assuming that's what you predominantly see.
Um, it depends. I mean, some of the centers we're involved in don't, but they're in smaller states. So
Mhm.
geographically, it's not necessary.
Yeah.
Um, but at least in a couple, they have, they may have more than one office, or they've done some way to make sure that there's equitable access across their geographies.
Okay. So what I'm wondering is, for instance, when you have these different regional centers, that are designed to meet the needs of that, the people in that locale, did you see where there was there like funds that regionally they were able to tap into because it's more kind of, local issues, local funding, people want to sponsor or organizations want to sponsor. And then if that's the case, did you also see where when funding dried up over here in this part of the state, maybe they were able to, sustain what they had because it was just more resources in the area? I'm just wondering those dynamics and how that might look.
Yeah, Lindsay or Alvina, please chime in if you have a different observation. I think so. New York has a regional system, uh, block grant. Right. So some states have they're leveraging block grant dollars because they see this kind of infrastructure as sort of foundational. Um, that's created a little bit of stability. You know, I wish I could say I've observed a solution to the volatility that comes with almost anything at this moment, which I haven't. Um, so and I think the one other element you raised, which I want to hover on, is, and this is where strategy is important. So in New Hampshire, um, the state used block grant and some state level substance use specific funding to fund the center. But the center was tasked to provide TA on priorities that were set by the state, for which the state was also making grants to providers. So, I will use the example of student assistance. So in New Hampshire, they had a priority to bring Project Success, which is an evidence-based student assistance program, to every school district in the state of New Hampshire. So they would award grants to school districts to cover the operational costs of hiring student assistance coordinators. Um, and then they funded the center to do a learning collaborative on student assistance programs. And if a school district got that grant, they were expected to participate in that learning collaborative, right? So that's where I think there's real opportunity to move a plan forward if the grant making strategy programmatically can be tied and tethered to the existence and engagement with that center. That has been, I think, a model that has yielded a little bit more stability in allowing an ecosystem to kind of evolve a practice over time. Is taking those two together, as opposed to, we're going to fund TA over here, and then we're going to make a bunch of grants over here there that don't talk to it directly, if that's helpful. Yeah. Wes, do you want to, can I turn over to you for any closing comments or your reflections on sort of process with the committee?
Yeah, so the questions that Tim posed, which we didn't have a ton of time to talk about today because it's such an expansive thing that we're undertaking, we're going to talk about every meeting for the remainder of the calendar year. So we have time to discuss this as a committee and contemplate those questions. Second thing I would add is that Tim and the Third Horizon team are our contractors for 3321. They will be checking in every other month. And so as we start to generate these discussions, I'm sure they would be happy to kind of consult with us as we go along this process to continue this conversation. So this is super exciting and gives us a really grounded foundation where we can have the next few meetings really concentrating on what we want this project to be. So yeah, thank you, Tim. We really, really appreciate you. Debbie, were you going to say something?
Yes, I just want everybody to really keep in mind that we're creating this, where it's and all these questions are great. We're not going to worry so much about money at the beginning. It's more like, if we had something like this, what would it look like? And then we'll be able to get more detailed into that. But dream big. and don't let barriers at this point in time, as far as what does it look like, where is it held, who runs it, or any of that. I think the one thing we found for the Third Horizon with their intense research is we don't have anything like this in Oregon. So we have the opportunity to learn from others and create it. Thanks, Wes.
Thank you, Debbie. One note in the chat: if you next month our meeting falls in spring, a lot of Oregon school districts spring break. So please, please, please let me know as soon as possible if you're going to need to be excused. That way, I know if we have quorum. And so please reach out to me. Next, we'll go into public comment. I know we have Roger from OHA here to give some comment. And Roger, I know we shorted you a bit of time. If you need to come back as well to follow up on this comment, go for it.
Cool. Thanks, Wes. Yeah, no problem at all, actually. Hi, folks. Roger Brubaker with OHA. I work on the Child and Family Behavioral Health team on youth suicide prevention, largely focusing on the Big River. That's our portfolio of trainings related to suicide prevention and mental ill health crisis intervention. I've been in this group before briefly to talk about a new training that we were developing and now have developed, and I just want to provide a quick update about that. Okay, so if folks are familiar with Be Sensitive, Be Brave, this is a new training, a new series of training that we have begun introducing to support suicide prevention, mental health crisis intervention, and now we have developed another version for substance use disorder intervention. This work has been done in coordination with Community Connection Psychological Associates. They're the folks that have created this series of trainings. We've gone through 2 pilot trainings so far in Oregon and incorporated feedback from Oregonians in the process of that development. Simultaneously, this development has been going on nationally in a variety of other locations to ensure that we are getting large representative groups of folks involved in the development of this training so that we can create a very robust evidence base. So in Oregon, like I said, we've gone through 2 pilot sessions, and we are now ready to implement version 1.0 of this training. We are still seeking feedback, though, from folks. So I have a couple of different kind of asks today to see if folks are interested in being involved in a variety of different ways. Number one, if you are interested in participating in or organizing a demonstration training for your group, community, or you would just like personally or know others that would like access to this training, please let me know. I'm going to put my email in the chat here in a moment for that. But also, if you're familiar with Be Sensitive, Be Brave already, just kind of in spirit, and know about this training, the fact that it centers culture and diversity and infuses those concepts in suicide prevention and crisis intervention. The same theme is going to be applying for the substance use disorder version of this training. If you recognize that concept as being essential to trainings like this, like we do, that's why we're introducing these trainings in the first place, and want to get involved, we will be hosting our first very small kind of pilot training academy for folks. So if you're interested in being a part of that training academy, we are actively recruiting folks. We're only looking for about 5 people. We have 2 or 3 already, and we're looking for a couple other folks who might want to get involved. So if you're curious about that, again, please let me know. Over the summer, we're going to be providing trainings to get further feedback for the development of version 1.0. And then we're going to be having a full training academy in either the fall or winter of 2020, this upcoming fall or winter of 2026, based on the information that we get from the pilot training academy and the demonstration trainings that those trainers will be providing over the summer. This work will be coordinated by Lines for Life, similar to how they are coordinating the work around Question, Persuade, Refer, and the Be Sensitive, Be Brave trainings right now. So I have, Wes, I have an email queued up to you actually after this meeting with like some just further written out information, flyers, things like that, if you don't mind being able to share that. with the committee, that'd be super helpful. And I'm going to include 2 links here in a moment in the chat before this meeting is over to make sure that folks can get connected to both the English version development of this training right there. And also we are simultaneously, we're a little bit behind in our development schedule on this. We are also developing a Spanish language version of this training as well. And that training, that version is being created, is being translated and created in cooperation with Latine and Spanish-speaking individuals in Oregon. So, okay, thank you for your time. I know I'm right at 12 here, so just throwing all that out there, and I'll follow up, Wes, like I said, with that email.
Great.
Thank you, Roger. And I know I'm going to connect with you because I'll just throw this out real quick that I had the chance to be on one of the initial meetings and had some concerns that it really didn't, a lot of it didn't fall in the primary prevention realm, which is, you know, our legislation and where we're working. There was a lot that was more on the harm reduction. And so I think that's something we'd really like to be able to partner better with you on. So I will follow up with you. Thank you so much for being here and giving us an update. Any other members of the public? I know we're a little bit over, but we really would like to hear with the rich discussion as well as be sensitive. I always say that wrong. Be
sensitive, be brave. Yeah, you got it.
Right.
Yep. Debbie, I've asked folks to submit written, given the time.
Okay. Okay. Thank you, everyone. Wes, did you get what you needed for spring break?
We will see. People communicate with me. I'd really appreciate it. Thank you so much.
Thank you, everyone.
Thanks, everyone.